Moving on to health news this morning, 1 in 8. That's how many women will be affected by breast cancer in their lifetime. It's actually the most common cancer diagnosed for women in the United States. Spectrum Health and the American College of Radiology urge women to get a mammogram every year starting at the age of 40. When detected early, breast cancer can be treated and cured. Spectrum Health Betty Ford Breast Cancer Services offers the most comprehensive breast care in West Michigan, providing state-of-the-art screening, diagnostics, education, and in-depth care to help women achieve optimal breast health. Joining me today, we have Mary Kay, Vice President of Spectrum Health Cancer Program, along with Cassie Smith-England, breast cancer survivor. Good morning, ladies. Thanks so much for being here with us.
Thank you.
So obviously October, a big month when it comes to awareness. So what is it that Spectrum Health is doing?
We're raising awareness and trying to take away any excuse that you might think of to get a mammogram. So we have 17 convenient locations and even have 2 mammogram buses that we bring to communities. You might have seen the big bus in pink. It's a Betty Ford Breast Center, out and about in the community, and we're out just about every day. So we have a lot of locations. It's easy access. You can even schedule online if you like, but to call, to make an appointment. And honestly, it takes less than a half hour. Usually, I just had mine not long ago, and usually you're in and you're out. It takes a little bit longer even just to put the gown on than it does to have the actual exam. And you know, you might not have known if you have dense breasts, but the technologist would tell you that, or your primary care doc, so we can do tomosynthesis as well, and it's not painful.
No.
People sometimes think it is, and it's really not painful at all. It's a little bit uncomfortable, but you know, nothing to stop you.
Yeah, I actually did one for the show. I brought a camera in with me for my first one, and I explained it as almost like a snake bite. When we were kids, we did the snake bites on the arms, how it twisted for a little bit, it was uncomfortable, and then what, for 3 seconds at a time or something, it's just really, there's nothing to it. I think the fear of going is worse than actually getting it done. And so as we continue to learn a little bit more about the breast cancer services in just a moment, let's go ahead and talk to you, Cassie. Let's talk about your story, because you are a survivor.
I am, yeah. Yep, I feel very fortunate. I was diagnosed at a very young age this year. In March, I kind of felt a lump. A long time ago, I had fibrocystic breast, so I was thinking it was probably just something benign like it had been in the past, but my fiance at the time was like, I really want you to get in, I want you to get it checked out, and I kept putting it off, but I honestly was needing him off my back, so I was like, fine, I'll just go in. And that's when I was diagnosed with stage 3 triple negative breast cancer. So I'm very fortunate that he pushed me into that, because me being so young, I didn't really take into account that I could be affected by breast cancer.
Do you mind sharing your age?
I'm 33.
So you are extremely young.
Yep, and the lump was when I was 32.
Okay.
When it was discovered. So it was just kind of a fast process. I did have my surgery October 27th or August 27th, and had a complete response to chemo. So I am NED, which is no evident of disease, so cancer-free, just going through radiation,
Fantastic. Now, do you have a family history?
No family history of cancer at all. So it was really unexpected for me.
So from here on out, you just have to do your it's constantly something you probably have in the back of your mind, but you know that you're in great hands. You're working with the Spectrum,
oh my
crew,
goodness,
right?
Yep. I've been working with Spectrum and Lemon Holton, and I have to say that they have definitely made this journey bearable.
Yeah.
You know?
And you have a story being published today, am I understanding that?
Yeah. Yep, my whole story is being published on Health Beat. John went ahead and did a story for me, came out and got to meet my family and get my story, which was pretty amazing. He's an awesome guy, so I'm excited for everybody to be able to see that.
That's fantastic. About these services you mentioned, now you said that you have that mobile unit. How far does that mobile unit travel?
We were just up in UP not too long ago.
Really?
Yeah, we travel all over the state, and when folks are interested in having especially come to rural sites, sometimes it's hard for women because of transportation issues, to get to a hospital to get mammography done, that we'll bring the van out there and do a number of women at a time.
I talked, we went and did a story recently with Spectrum, and I talked about getting my next one done in the mobile unit with a TV camera with us to show people, okay, look, you're going to get the same type of service in this mobile unit, so don't be afraid to go do it.
Yeah,
So,
thank you for doing that, and thank you for raising awareness. It's a quick, easy thing. It's a peace of mind,
Yeah.
and when you find your cancers early, you have a better chance of success, like Cassie.
And you just have a continued support system now, right? You're part of a really unique family.
Yeah,
Yeah.
really am. I also have 2 children, so it's just been like quite a journey that we've all been experiencing together.
Right,
So,
and you're not alone, so
No.
that's great to know.
It is.
All right, so once again, super easy for people to set up those the mammograms. Go online, call, do what you have to do. Self-exam, so important, right? Like you discovered yours.
Self-exam, yes.
Self-exam.
Yep.
How you
No
did it.
excuses.
No excuses.
No.
All right. So if you are 40, especially, the time is now. But if you are high risk, also the time is now. For more information on Spectrum Health's breast cancer detection services or to set up that appointment, contact Betty Ford Breast Care Services at 877-495-2626. And to read more about Cassie's story, visit spectrumhealthbeat.org. Thanks for stopping by, ladies.
Thanks for
Thank you
having
for
us.
having